This is a brief demonstration of Channel 19, the Enterprise Health COVID-19 employee monitoring application. This workflow depicts employee self-reporting and then shows an administrator or clinician managing the employee monitoring work list and documenting within the employee chart. The application will automatically send employees an email prompting them to go to an employee portal to complete a monitoring questionnaire. The frequency of how often this email is sent, as well as the email content, is configurable. Only the employees who have been added to the medical surveillance panel for COVID-19 employee monitoring will receive this email. Medical surveillance panel membership designates who is monitored, and it can be configured. Employees can be individually added or added in groups automatically from an HR import using business rules based on job code, department, or other criteria. The email contains a link to the employee portal. When the employee clicks on the link, they're launched directly into the questionnaire. Some of the fields may default to the information that was previously entered. The questionnaire itself can also be customized. For some of my answers, I'm going to answer as being symptomatic. That way, a special COVID team will be alerted. And now I'm going to hit submit. Since I reported symptoms on the questionnaire, the system will automatically send an email to each user of the COVID-19 response department. Now I'm going to take off my employee hat and put on my administrative hat. Since I am a part of the COVID-19 response department, I will automatically get an email if an employee reported symptoms. This email has a link to go directly into the submitted questionnaire responses. Now I'm going to go into the application as a program administrator and show you the COVID-19 work list and walk you through how to document an encounter for that employee. When I log in, I'm taken to this landing page. There are 3 sections called portlets on my landing page that contain a chart search, the COVID-19 monitoring work list, and a display of my recent charts. The COVID-19 monitoring work list shows the employees who need additional attention based on their questionnaire responses. You can see their name, phone number, supervisor's name. If I scroll over to the right, you can see a lot of other information such as their last self-report, their last work day, if they were referred for testing and the test result, and any restrictions. Now I'm going to open the employee chart and give you a quick tour. I can launch directly into the employee chart by clicking on their name. When the chart is open, I can see information about the employee at the top, including their name, age, date of birth. I can also see any current restrictions. In addition, I have these little portlets. This one shows some basic demographic information. I can see a medical history, last vitals. I have quick links to launch into my document. I can see their allergies and medications. Within the chart, I also have chart tabs on the top. I'm on the Summary tab. If I click on the Limited View Documents, this takes you to any of the documents related to the COVID-19 questionnaires. And then I also have my encounters. To jump into this employee's encounter and begin documenting, I'm going to click on the Add Illness Screening link. The encounter is organized into sections, and I can use these blue buttons to quickly navigate through the encounter. A few sections that I want to point out are, here is the case manager. This is how I can assign who can be responsible for monitoring the patient, and I'm going to place myself as the case manager. As I scroll down, I can see a questionnaire section. This is going to display a link to the questionnaires that were answered within the last 60 days. If I click on the link, it will go to a new tab so I can review the questionnaire and quickly hop right back into my encounter. Next, I'm going to go to the plan narrative. The plan narrative can be customized to fit each client's needs. If you're a testing site, you can also initiate the order for the COVID test here, or in this example, I'm going to refer the employee for testing. I'm going to enter a note and also a follow-up date. I can also place this employee on any restrictions. So if I'm taking them out of work and I'm tracking lost time, I can quickly and easily do that. Once this restriction is entered, the employee's supervisor will automatically get an email, and the supervisor can also access employees with restrictions via the supervisor portal. The last thing I need to do is to put this encounter on hold. I can always come back in the encounter to log test results or case notes. The application can also be used to track and monitor employees who test positive for COVID-19 and to manage the return to work process. The application also includes COVID-19 reports that generate clinical metrics. This concludes the demo of Channel 19, the Enterprise Health COVID-19 Employee Monitoring application.